about the leadership methodology that we've had so far in our country after the HITECH Act and after, Obamacare or the ACA, we've built organizations to really feel like they're in silos, right? So the CFO's perspective on a health system was fee for service, volume, right? While the CIO is, I got to replace this EMR, or I got to implement this EMR, et cetera, right? The CMIO is worrying about, clinical workflows and pathways. The chief medical officer is just making sure that our providers are not leaving and that they're staying and providing quality of care, right? And so what the MHL does, it cuts across all of those things, right? And it creates really the CVO, what Simon Sinek calls the CVO, which is the Chief Vision Officer, is the visionary, is a transformative leader that comes in and brings together the friendship between those C-levels to interact and understand outcomes-based medicine, outcomes-based financial models that are going to make the organization sustainable for future generations.
Yeah, so I love that idea. I love that CVO.
The CVO,
Yeah, I love that. Well, I think too, just based on the vision, again, it takes a special person to be that CVO. You can't be overly focused on any one of those C-level areas. And at the same time, the C-level individual, whether it's the chief medical officer or the chief finance, you do have to have a very weedy level view of your area. You have to be the expert in that area, but having the person to unite, and that doesn't always have to be the CEO. Yeah, the CEO has, the responsibility for the health and wellness of the organization and certainly for the strategy, but they can often get lost in the extreme expectations of what a CEO is and does. And so, to have somebody who really unites all of the levels, including the CEO, with that vision. Okay, what is the vision? I think would be great. I love that idea.